Good evening and welcome to tonight's Love Your Liver webinar. We will begin shortly. Good evening and welcome to the Love Your Liver Live webinar. Thank you for attending today to learn more about this very important topic for the African American community and how liver cancer affects it. Today we have an expert with us, Dr. Landry, to discuss liver cancer risk factors, what you can do to help yourself and your loved ones. Now, this webinar is in part with the Adrian Wilson Foundation Association, which is a nonprofit that aims to prevent, treat, and cure primary liver cancer. Dr. Landry will discuss liver cancer risk factors and what you can do to help yourself and your loved ones. After the presentation, there will be a question and answer session with Dr. Landry. In addition, we want to thank Ochsner Baton Rouge, DREF, which is the Delta Research and Education Foundation, and the West Africa Institute for Liver and Digestive Diseases for their partnership in making this event possible. Now, as I said, at the end of the presentation, you'll have the opportunity to ask Dr. Landry questions. On your right-hand side, you will see the Q&A box or a button that says chat on the bottom right corner. This is where you can type in your questions, view poll questions and answers. Yes, I did say poll questions because this is going to be a very interactive presentation. Please feel free to type your questions at any time during the presentation, but we will not answer them until the Q&A session. We do apologize in advance because we may not be able to answer all of your questions. Now, there are few rules about questions to note. There are few rules about questions to note. This is an educational presentation, so please ask questions that are general in nature and do not ask about your personal health situation, as Dr. Landry is not your personal doctor and cannot provide personal medical consultation during the event. Now, throughout the presentation, as I mentioned, there will be poll questions, and we ask everyone to participate. We hope that you will join in on the fun and answer the questions as they pop up on your screen. We thank you in advance for your cooperation and participation. Now, let me introduce you to Dr. Landry. Dr. Landry is the head of hepatology at the Liver Center, Ochsner, Baton Rouge. She has been fellowship trained at the Baylor College of Medicine in gastroenterology and the Tulane School of Medicine, where her field of study was transplant hepatology. Her special clinical interest is in liver disease and its management. Now, let's get started with a poll question. What do you think? Black Americans are more likely than the general population to get liver cancer by how much? A, 50%, B, 75%, C, 100%, or D, 150%? Go ahead and select your answer. I'll read the poll question again. Black Americans are more likely than the general population to get liver cancer. How much more? A, 50%, B, 75%, C, 100%, or D, 150%. I will give you about 20 more seconds, 10 more seconds to answer this question. The correct answer is D, 150%. Black Americans are 1.5 times more likely to get liver cancer. Dr. Landry, why is that so?
Well, first, I just want to say thank you for that introduction and thank you for everyone who's attending this evening. I'm excited to spend this next hour with you talking about liver cancer in the Black community. And yes, as you can see, Black Americans are 1.5 times more likely to get liver cancer. The reason for that is there are various risk factors that are associated with liver cancer, and those risk factors tend to be higher in the Black community. So I'm excited that we're going to share a number of those risk factors with you, and then you will better understand, hopefully by the end of this session, why African Americans are at a higher risk of liver cancer. So we're going to go ahead and get started. This is what we'll discuss today. We'll talk about what the liver is and how it works, how common liver cancer is, the risk of liver cancer, being diagnosed, available treatments, and steps you can take. This is really a jam-packed hour, and so you will have a lot of information that hopefully you learn that you can pass on to your family and your friends as well. So the liver actually sits in the top right part of your belly. It sits underneath the rib, so it's nice and protected by the rib cage on the right side. It's actually the largest organ inside of your body. The only other larger organ is the skin. And it has about 500 jobs for your body. It's the only organ inside of you that can regrow itself. There are many people who ask me, like, Dr. Landry, how did you decide to become a liver specialist? That seems so random. And in fact, it really is. I didn't know what the liver did until I got into medical school. But once I saw patients who had sick livers, I was fascinated because the liver does so many things that I was surprised, because it's such a filter in your body, that when you have liver disease, you can have issues with your mind and your thinking. You can have problems with your kidneys. You can have problems with your lungs. You can have problems with your skin color. You can have problems that I just really had never thought about before until I saw patients with sick liver disease, because the liver is such a powerful organ. It really does filter just about everything that you eat and drink. So it can remove toxins from your body. It even breaks down fats and cholesterol by secreting bile, B-I-L-E, that will help to break down those fats and cholesterol. And it also breaks down carbohydrates and proteins. So it's very important in kind of regulating the amount of glucose that we have in our body. The liver is a very, very complex organ. Well, how common is liver cancer? So unfortunately, liver cancer is on the rise in the United States. And that's unusual because most cancers actually are on the decline. Like, we're getting better at diagnosing, we're getting better at screening. So therefore, we're seeing less of them. Overall, we're getting also better at some of the risk factors associated with other cancers. Whereas liver cancer, it's been the opposite, that's been on the rise. There's actually up to a 34% increase in people with liver cancer from 2000 to 2019. And it's estimated that around 41,000 Americans will get liver cancer diagnosis in a year, or in this year alone, and 30,000 are estimated to die from liver cancer. I mean, that's really staggering. And I just want to point out what's really staggering and concerning is that if 41,000 get the cancer, then 30,000 die from the cancer. You can see that the outcomes with liver cancer are not good. So it's not a cancer that you want to get, because when you get it, we don't always do the best job at getting it treated and cured. And it's a cancer where a lot of people do end up dying from their cancer. So if we can try to prevent the development of liver cancer, that's by far what we want to try to do. What about liver cancer in Black or African Americans? Well, liver cancer is also known as hepatocellular carcinoma, or you'll hear people refer to it as HCC for short. And it's the most common type of liver cancer. And the number of people in the Black community getting HCC is really growing. So it's on the rise. We already talked about the fact that liver cancer is 1.5 times more likely in the Black community compared to the general population. But not only are we more likely to have liver cancer, but unfortunately, we're also more likely to die from liver cancer. So it has the highest death rate of any ethnic group. And African Americans are less likely to be diagnosed at an early stage of cancer. We're going to talk a little bit later about staging, but obviously, if you can catch the cancer earlier, then the likelihood of you surviving the cancer is better. Well, in African Americans, we tend to be diagnosed when the cancer is at a more advanced stage, meaning that our chances from dying of the cancer are higher. But even though I'm kind of telling you the bad news, there is good news. And part of the good news is that you're here today on this education. Good news for you personally, and then hopefully good news for other people in your circle. Because with education and taking control of your health, you can help manage your risk for liver cancer. So there is some power that you have. Primary liver cancer is a cancer that begins in the liver. That's important to recognize because sometimes I'll ask people about different cancers they have or if their family had cancers, and they'll tell me that the person had liver cancer when it probably was unlikely that they had primary liver cancer, and they may have had metastatic disease to the liver. So often cancers from other places can go to the liver, but that is different than what we're talking about today, which is primary liver cancer, meaning that the liver cancer started in the liver itself. Okay. And so the most common primary liver cancer is hepatocellular carcinoma, or HCC, as we mentioned, and that makes up more than 80% of primary liver cancers. Well, what about these risk factors, like I started to talk about in the beginning? Well, a risk factor is a reason that someone would be more likely to get a disease than the average person. So again, what are the things that are making African Americans more likely to get a disease than other people? So some of the common risk factors for liver cancer include medical conditions, which we'll discuss through this presentation, lifestyle choices, which we'll also kind of go through, as well as ethnicity. And we've already said that being Black or African American is a risk for liver cancer. So what do you think? We'll go ahead and see about this poll question.
Absolutely. Thank you, Dr. Landry. So which of these are risk factors for liver cancer? A, hepatitis C, B, type 2 diabetes, type 2 diabetes, C, being Black or African American, or D, all of the above. I've opened the poll. Go ahead and get those answers in. I'll read the question again. Which of these are risk factors for liver cancer? A, hepatitis C, B, type 2 diabetes, C, being Black, African American, or D, all of the above. I see those answers coming in. We'll give it about 10 more seconds. Okay, the correct answer is D, all of the above. Dr. Landry, share why that is.
Yeah, so if you answered D, that was correct. Hepatitis C is a virus that affects the liver, and that it can cause scarring in the liver over time. And that scarring can often lead to cirrhosis of the liver, which is the most advanced scarring you can have. And we know that cirrhosis is one of the biggest risk factors for liver cancer. So hepatitis C is certainly a risk factor. Type 2 diabetes has also been shown to be a risk factor for liver cancer, as well as being African American or Black. So you can see that why African Americans may have higher risk for liver cancer, because we certainly have a higher association with diabetes. Most of you may be aware of that, but what you may not be aware of is that we also sometimes are disproportionately affected by hepatitis C. So all of these risk factors are risk factors for liver cancer. Well, let's go back. Let's start in the beginning of the alphabet. Let's go back from C and go to B. So, hepatitis B virus is one that you may not be very familiar with, but hepatitis B is a virus that also affects the liver. It's transmitted more commonly through sexual secretions as well as blood to blood contact. So, through transfusions, injection drug use, razors, anything where blood is in contact or sexual contact. And so, African Americans are actually 2.6 times more likely to die from hepatitis B than non-Hispanic whites, which is interesting because we're less likely actually to get hepatitis B, although hepatitis B can be found in the Black community, but we are more likely to die from it. So chronic hepatitis B can lead to cirrhosis. So I mentioned to you just a few seconds ago that hepatitis C can also lead to cirrhosis. The idea is that these viruses infect the liver, and then you can get inflammation and scarring, and that scarring can become stage 4 scarring, which is cirrhosis. And that cirrhosis then replaces all the healthy cells and also becomes a risk for liver cancer. So, cirrhosis certainly increases your risk of liver cancer, but hepatitis B is unique in that hepatitis B can cause liver cancer even without cirrhosis. So, I mentioned to you before at the question that hepatitis C is associated with liver cancer, but that's usually through the pathway of cirrhosis and then cirrhosis putting you at risk of the liver cancer. Or that can also happen with hepatitis B, putting you at risk of cirrhosis, and then cirrhosis putting you at risk of the liver cancer. But with hepatitis B, you don't necessarily need the cirrhosis part. You can go just from having hepatitis B to then developing liver cancer. So you certainly want to ask your doctor to screen you with a blood test for hepatitis B. That's the hepatitis B surface antigen. That's usually the test that we will recommend for screening for hepatitis B. And you also actually want to make sure that you're protected against hepatitis B, meaning that you have the antibodies to protect you if you were ever exposed. So that's hepatitis B surface antibody. There are vaccines for hepatitis B, and in fact, most kids who are born now are automatically vaccinated against hepatitis B. But if you're older, then you may not have been automatically vaccinated. So again, you want to make sure you talk with your doctor about getting screened and then also making sure that you're immune or protected against hepatitis B. So here's hepatitis C. So hepatitis C is something that you may be more familiar with. It was really the leading risk factor for liver cancer in the United States for quite a long time. And hepatitis C for a long time has also been the most common cause and need for liver transplantation as well. So hepatitis C is a really big public health problem. It's been around a while, and a lot of people associated with baby boomers. But because of the opioid epidemic, hepatitis C is not going around. We're seeing it more and more in people who inject drugs. And in fact, 50% of people who inject drugs will have hepatitis C. And the majority of new cases of hepatitis C are in people who inject drugs. So we have a growing number of people in their 20s through 39 years of age who are contracting hepatitis C, yet it can result in a lot of significant liver disease that I mentioned, such as cirrhosis, and then puts you at risk of liver cancer. And here again, you see that Blacks or African Americans are almost 2 times as likely to die from hepatitis C compared to white Americans. Although hepatitis C can be treated and cured. And so that's an important point to point out because this can decrease your risk of liver cancer if we can get you cured of hepatitis C if you have it. Hepatitis B is not thought to be curable. It can be treated very effectively, and we can suppress the virus and therefore also decrease your risk of liver cancer with treatment of hepatitis B, but it's not curable, whereas hepatitis C can be cured. So you definitely want to make sure that you're reaching out to your doctors and getting screened. And the recommendation for Hep B and Hep C, in my opinion, as well as supported by our public health organizations, is that all adults really should be screened for both hepatitis B and hepatitis C. So Black patients with hepatitis C can develop liver cancer at earlier stages of their liver disease. So their liver disease may not seem as advanced. They may not even have cirrhosis of the liver and still be at risk for developing liver cancer. So you certainly want to make sure you're screened for hepatitis C with the hepatitis C antibody. So everyone should really know their status. If you do, great. If you don't, make sure you're following up with your primary care doctor. Because again, there are things that we can do to decrease the risk of liver cancer. And it starts by making sure that we adjust and modify these risk factors. So what do you think?
Absolutely. Time for another poll question, so get your fingers ready. Black Americans are more likely than non Hispanic white individuals to die from hepatitis C. By how much more? 10%, B, 43%, C, 88%, or D, 120%? I'll read the question again as you all are getting your answers in. Black Americans are more likely than non Hispanic white individuals to die from Hep C. By how much? 10%, B, 43%, C, 88%, or D, 120%? Now, as you are getting those answers in, I do see questions coming in. So be sure to continue to add your questions so we can get to them at the end of the presentation. I think we're ready for the answer. The answer is C, 88%. Black Americans are almost twice as likely to die from Hep C. Dr. Landry, can you share more about why that is?
Yeah, so I think that's an important question because I'll kind of test it if you were listening because we told you the answer to this one already. Yes, we're more likely to die from Hep C. Part of the problem is that for hepatitis C, a lot of people don't have symptoms. So you can be asymptomatic for a long period of time. So there are many people with hepatitis C who don't know they have it. So they may be living with it for 20 to 30 years before they're ever diagnosed, and therefore they could present already with cirrhosis or even liver cancer. And so certainly if you present later because you haven't been managed for the disease, then you're more likely to die. And that's often happens in the Black community. We often have worse access to health care, or we may not as often have insurance. And so therefore we're not getting diagnosed for these conditions in a timely fashion. So therefore we're presenting later and more likely to die from hepatitis C. But you're here, you now know that you can screen for it, you know that you can be treated for it, and that is in fact curable. So my goal, especially in my role in the work that I do with the state, so I'm Louisiana's clinical expert on the elimination of hepatitis C in our state. And I take this job very seriously because I think this can really change the health outcomes for all of our communities, because the more we can focus on eliminating this virus, the more we can focus on reducing the likelihood that people develop very serious complications, because it's certainly curable. So what about other risk factors? Type 2 diabetes. I mean, Black Americans, as most of you know, are 2 times as likely to get type 2 diabetes. I'm sure we all know someone in our family and our families who have type 2 diabetes. And we often have more complications when we have diabetes for the same reasons. Often we may not be in care, or from lifestyle choices, how we eat, the types of food we eat, lack of exercise. There are a number of things that go into this, but it's not a hard sell for me to tell you that African Americans are more likely to have diabetes and more likely to have complications from it. And studies have shown that type 2 diabetes is linked to an increased risk of liver cancer. But type 2 diabetes is a risk factor that we can try to manage. We can try to manage it by managing our weight, by managing the types of foods we eat, by making sure that we're in good communication with our doctors and following up on our medications and making sure that we're compliant with medications and making sure that the diabetes is under control, that hemoglobin A1C, which is a measure of how well your diabetes is under control, is truly under that 7% mark, if not lower. So what do you think?
Time for another poll question. Is type 2 diabetes an independent risk factor for getting liver cancer? A, yes. B, no. I'll read the question again as you're getting your answers in. Is type 2 diabetes an independent risk factor for getting liver cancer? A, yes. B, no. I'm beginning to see those answers come in. We'll give it about 10 more seconds. All righty, let's see what the answer is. The answer is yes. Type 2 diabetes has been shown to be a direct risk factor for liver cancer. Why is that, Dr. Landry?
So there are different thoughts about around this one. So some people think that type 2 diabetes is also associated with obesity, and we know that obesity and type 2 diabetes are an increasing risk for what we call non-alcoholic fatty liver disease, basically where you get fat in the liver with inflammation and scarring, and that can cause damage to the liver and even lead to cirrhosis. So some people refer to it as fatty liver. Some people refer to it as NASH, non-alcoholic steatohepatitis. Again, it's fat in the liver from these risk factors of having an elevated body mass index, being obese, having diabetes. We know that all of these risk factors come together and cause worse liver disease, and that fatty liver can result in increased risk of liver cancer. Some of the naming terminology is changing. So some people aren't referring to it as fatty liver anymore. In fact, our liver societies, we've kind of switched it to being metabolic associated steatotic liver disease. So again, it's a mouthful, or metabolic associated steatohepatitis, but it's the same concept that these metabolic risk factors of fatty liver, diabetes, are really what put you at risk of worsening liver disease and scarring and fibrosis, and then therefore liver cancer. Another thought is that high levels of insulin in some ways are actually promoting cancer development. And so when you have diabetes, you're not kind of taking in glucose well. So your body is really ramping up that insulin to try to get your cells to use that glucose better. And some thought is that increased insulin levels actually are also associated with increasing the cancer risk. So this takes us to obesity. That's what we kind of talked about as well. We talked about that obesity can lead to type 2 diabetes and what's called NAFL, that non-alcoholic fatty liver disease, which again, the name has more recently changed to metabolic associated steatotic liver disease, but all the same. And some people just know it as fatty liver. So both of these are risk factors for liver cancer. How do you know if you're obese? Because, I live in Louisiana. So a lot of people in Louisiana are obese, but when we look at people, we don't necessarily consider them obese because that's just kind of how our body makeup can be in the South or Southeast. But in fact, there are real cutoffs that let us know if we're obese or not. One is body fat percentage. So the body fat percentage will vary between men and women in terms of obesity. So for men, if you have body fat percentage greater than 25%, you're considered obese. For women, it's greater than 33%. So, women, we're allowed to carry a little bit more weight, which is nice. But BMI, it doesn't change regardless of gender. So the BMI scale, 20 to 25 is considered a normal BMI. 25 to 29 is considered overweight. And then 30 to 39 or all the way up to almost 40 is considered to be obese. And then 40 or greater is considered morbidly obese. So it's really important to know your body mass index. You may not want to know because we may be in denial about what that is, but for your own health, not just as it relates to liver cancer, but we know that obesity is associated with a lot of other poor health outcomes. It is very important to know your body mass index. So if you don't know your body fat percentage or your body mass index, make sure that you see your doctor. And it's important to understand if you're in a normal body mass index, if you're overweight, if you're obese, or if you're more, excuse me, morbidly obese. Excuse me. So there's some dietary factors that can play into this as well. If you look at this picture, that's like the traditional kind of Thanksgiving, Christmas meal. It's a diet full of red meats, excuse me, high fat sides, and those can increase your risk of being overweight or having diabetes, excuse me. Whereas we know the benefits of like what I consider more of a whole food diet, a diet that's full of fruits, vegetables, whole grains, like brown rice, oatmeals, nuts, beans, fish. They can reduce the amount of fat in your liver. Even if you don't change how much you weigh, reducing the amount of fat still can be beneficial. So this is more some of the lifestyle risk factors that we talked about in terms of the risk of liver cancer. So we went through some of the medical conditions that you can have, but now these are some of the lifestyle. So diet. So having more of a whole foods diet is very beneficial. Again, not just for the risk of liver cancer, but we know with heart disease and many other outcomes are affected by diet. So this is what we see, kind of lifestyle choices, alcohol, needle sharing, smoking. We'll talk about some of these as, again, risk factors for liver cancer. So what do you think?
So let's get those fingers ready. Is being a part of a certain ethnic group a risk factor for getting liver cancer? Is being a part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. I'll read it one more time. Is being a part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. I see those answers coming in, and I see those questions coming in as well. So don't forget to add your questions during the presentation. Let's take a look at the answer. The answer is A. Certain ethnic groups have a much greater risk of getting liver cancer. Now, does it matter what ethnic group I'm in, and why am I more at risk of getting liver cancer?
So we touched upon this, kind of to start and throughout. Obviously, we're here today because African Americans are at a higher risk of getting liver cancer, and we want to try to break that cycle. And part of it is likely tied to some risk factors. We don't know if there's anything specifically about being Black in terms of genetics that might predispose us. That certainly is a possibility, but we haven't elucidated that yet. But as I've spoken to you already about, certainly hepatitis C, which can be more prevalent in the Black community, having obesity, diabetes, all of these risk factors, as well as some of the other behavioral risk factors and lifestyle risk factors, can be in the Black community and put us at increased risk of liver cancer. So you really want to know your risk and take action. So this is just a nice summary slide. So think about yourself, think about your family, your loved ones, people in your community. Think about diabetes, making sure that people have their blood sugars controlled is really important to reduce risk. We talked about hepatitis B. Even though it's not curable, it's certainly treatable, and you certainly want to know if you have it or not. Now, hepatitis B is not treated in everyone, so I want to say that. So your doctor would have to decide if you really need treatment or not. But certainly hepatitis B can increase the risk of cirrhosis and liver cancer, so you want to know your status. Hepatitis C certainly is easy to screen and diagnose and treatable and in fact curable, but increases the risk of liver cancer. Obesity through diet, right? We talked about less red meats, high fat dairy products, processed foods. You want more fruits and vegetables, things where you don't need to read a label to really know what's in it. Alcohol, so no more than one drink a day for women and two for men. Again, I live in the Southeast. I live in Louisiana. Everything is done around alcohol. And so our concept of what's, normal drinking is often skewed because in fact, for women, it's just two standard drinks. And so you have to make sure you know what a standard drink is, not a huge whole bottle of wine, like in one cup. It has to be kind of your standard drink, two for men, and only one for women. Needle sharing. So we still are seeing people get hepatitis C, as I mentioned, from sharing needles, especially with people who inject drugs in the opioid epidemic. But there's still homemade tattoos that are being done or tattoos that are done in incarcerated populations. So definitely, if you have any high-risk behaviors, make sure you're not sharing needles, using your own supplies if you are doing drugs, because there's an increased risk of hepatitis C transmission through injection as well as non-injection drug use. Smoking is a risk factor for a lot of things in terms of poor health outcomes. So really talk to your doctor about resources to help with quitting smoking. And then as we talked about ethnicity, being Black and African American. So you want to really feel empowered, to go to your doctor, right? You don't have to just let your doctor always set the agenda for your visits. I encourage each of you, if you have stuff going on that you're worried about, whether it's going on in your body or after seeing presentations like this that you're concerned about, go and set the agenda with your doctor. Say, hey, I heard that I could be screened for Hep B and Hep C, and make sure that you get that screening that you need. Hey, I want to know what my body mass index is. Tell me about some things that I can do to work on my weight. I'm having trouble stopping alcohol or smoking. Please provide me resources. So work with your doctor, get tested, and most importantly, get those risk factors under control so that you can decrease your risk or likelihood of developing liver cancer. So now we're going to shift from risk factors to shifting to like, well, how do you even diagnose it? How do you treat it? Kind of how do we think about things kind of maybe once you develop liver cancer? So liver cancer is usually diagnosed by imaging, really. In people who are at high risk, especially those with cirrhosis, we can diagnose liver cancer by imaging alone, which people are very surprised at. So the majority of patients that I work with, especially as a transplant liver specialist, we diagnose a liver cancer without even a biopsy. It's diagnosed based usually on CT scan and MRI scan. So an ultrasound is what we do to screen for liver cancer. So basically, if you have these risk factors, your doctor may screen you with an ultrasound. If you have cirrhosis of the liver, the recommendation is that you get surveillance so that you're getting an ultrasound with an AFP, that's an alpha fetoprotein, that's a tumor marker for liver cancer, that you get both of those every 6 months when you're at very high risk of developing liver cancer. Then to make the diagnosis, as I mentioned, we do a CT scan or an MRI. You're usually going to get blood tests as well, like a complete blood count, comprehensive metabolic panel that looks at your kidneys, your liver test, your liver function, the hepatitis panel, because again, you want to see if you have hepatitis B or C, what is putting you at risk for liver cancer. And then there are other tumor markers, like I mentioned, the AFP, that can be used to screen for liver cancer. There will be some people who do need biopsies if the imaging isn't classic for liver cancer or the person is not thought to be at high risk for liver cancer, but we see a liver lesion, then sometimes we will have to biopsy to make the diagnosis. But a cure may be possible if liver cancer is detected early and removed by surgery. And that's why we've talked about this. Finding these cancers early and at an early stage is definitely life-changing. So you want to talk to your doctor about being tested regularly, especially if you have risk factors that we've talked about. So how to determine the liver cancer stage? So when liver cancer is diagnosed, then we have to figure out just how serious it is. And we do that in a process called staging. So there are two parts of staging in liver cancer. And the reason why there are two parts is because liver cancer also results in from liver disease where that can be affected by how the liver is actually working. So the first part of staging is determining like how big is the liver? What's the size of the liver? Is the cancer spread outside of the liver? If it has spread outside the liver, to what body parts? And what's interesting about liver cancer is that I'm often more worried about spread within the liver, like how much cancer is in the liver to stage, sometimes more than I am about it moving outside of the liver. Because it usually takes a while for the liver cancer to move outside of the liver. But if there's a lot of cancer within the liver itself, then that also means that you're a more advanced stage. So the next part of staging is, what is the liver function? Because we said often people get liver cancer because they have cirrhosis, and cirrhosis affects how your liver functions. And if your liver is not functioning, you can have ascites or fluid in your abdomen. You can start turning yellow or called jaundice. You can get confusion. We call that hepatic encephalopathy. You can have big blood vessels in the esophagus called varices. So there are a lot of signs and symptoms that can come from liver failure. If your liver is functioning well and you don't have any of these, or if you have mild aspects of these, you're what's called class A. If you have mild abnormalities that are more present, when you look at labs or look at someone on an exam, then that's class B. And if you have more severe abnormalities of liver dysfunction, that's called class C. Most of our treatments are really going to be for those who are class A, with the exception A and maybe B, with the exception of that being people who get liver transplants, because certainly one of the main reasons for liver transplant is because the liver is not working. But another big indication for liver transplantation is liver cancer. So this is the three general stages of liver cancer. There's early stage where it's resectable or transplantable, and that's what you want. If you're identified early where there's not a lot of tumors or the tumors are smaller in size, then if you don't have cirrhosis or if your liver is functioning very well, you could just have the cancer removed by surgery. But I will tell you, most people don't have enough good liver left to have the cancer removed by surgery. Most people have to have a transplant. So they need the whole liver taken out and then they get a whole new liver. And that's the best and most likely curable option. Often I find people are not referred early enough to a liver specialist like myself to make sure that they know transplant is the best curative option. And sometimes they're treated with all kinds of other things that we'll talk about, in these next slides before they're offered transplant, where transplant is usually going to be the best and most curable option if it's early stage. If it's intermediate stage, meaning the liver cancer is not really resectable by surgery, but it's not outside of the liver, then that's when you want to think about other options for treatment. So these patients are unlikely to be able to have surgery and are unlikely to be treated with a liver transplant. Sometimes when you're in intermediate stage, you can be what we call downstage to then where transplant is possible. And you're downstage with local therapies that we'll talk about in upcoming slides. Then if you have advanced cancer, this is liver cancer that has usually spread to lymph nodes or other organs, or if it's advanced, if you're very decompensated or class C like we talked about, and there's also extensive cancer within the liver. So treatment with surgery is not likely, and these individuals are unlikely to be downstaged. So what do you think?
Let's go at it again. What are some reasons liver cancer cannot be treated with surgery? What are some reasons liver cancer cannot be treated with surgery? A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Let me read this again. What are some reasons liver cancer cannot be treated with surgery? A, the cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Or E, all of the above. You all are so quick. I'm going to give you 5 more seconds. The answer is all of the above. Dr. Landry, tell us a little bit more.
Yes. So just in the interest of time, I think I elucidated kind of the reasons for all of these in terms of just not having enough healthy liver. You don't want to take someone to surgery and then take out part of the cancer or take out the cancer and then they really die from liver failure. Or if it's spread too much throughout the body, then just taking out or doing surgery is not going to be beneficial to them. So what about early stage treatment options? We talked about surgery. When liver cancer is caught early, there is a chance for cure. Cure means that we don't think it's going to come back. But remember, anytime we treat cancer, even if we think it's cured, we still have to monitor it because there is always a risk of recurrence. So local therapy treatment is focused on a specific area, like we talked about surgery, just cutting it out. That's for people who may not have cirrhosis or who have what we call very well compensated liver disease. Their liver is functioning very well. Transplant is usually going to be what we're going to do most of the time in people who have early stage cancer, especially because these are patients that typically have cirrhosis and they're at risk of getting liver cancer again or having it in different parts of the liver where we may not see it. As we talked about, liver cancer can come back. So you always want to make sure you're continuing with close follow-up with usually, like I said, a hepatologist to make sure that it's not recurred. But what about this intermediary stage that I mentioned, the non-surgical local therapies? So these are local therapies that directly treat the cancer. One of which is ablation. That's where radiologists can go in with a probe and really burn the cancer, either with cold or heat, radio waves, microwaves, chemicals, and just burns the cancer. So you have to be in a very early stage for that to be an option. We do use that. More commonly, what we do is what was called radiation therapy or yttrium therapy or Y90, you may hear it called. That's where the radiologist goes into an artery and uses their catheter to go towards the cancer. They will find the cancer and they will inject it locally with radiation beads. They can also do what's called chemoembolization, where they inject the cancer locally with chemotherapy beads. So as you can imagine, this therapy can be very effective, but it's not often thought to be curative. So it can keep the cancer gone for some time, but the concern is that the cancer will come back. Because transplant is the best option, people can't be transplanted immediately when they have liver cancer. So many people have to wait 6 months to a year, if not longer, before they're transplanted for their liver cancer. So we will use these local regional therapies in the meantime to treat their cancer while we wait till they get to a curative option. So they will get ablation, chemoembolization, or radioembolization while we wait to get them to transplant. So these are kind of bridge therapies to transplant as well. What do you think?
That's right. So there are no treatments for advanced liver cancer. What do you think? There are no treatments for advanced liver cancer? A, true. B, false. There are no treatments for advanced liver cancer. A, true. B, false. Let's get those answers in. Well, we're going to go ahead and show you the answer at this point. False. Although there are no curative options, there are many medications for advanced liver cancer. Dr. Landry, share more.
Yes. I think these next slides talk about that. So, for advanced stage cancer, there are treatment options. We consider that usually systemic therapy. Systemic therapy means that the treatment works throughout the body. And so, you can imagine if there's a lot of cancer in the liver or cancer in other organs or lymph nodes, you don't want to do the local regional therapy because that only targets a small area. You want treatment that can go all over. And in fact, some studies have suggested that 80% of HCC or liver cancer is diagnosed at a stage that's too advanced for local therapies or too advanced for curative options like transplant. But developments do continue in the treatment of liver cancer that's advanced, and a lot of improvements really have been made over the last 5 years. We used to have very few options, and the options that we did have really did not result in very good outcomes. But over the last few years, with the development of immunotherapy, using the immune system to really attack cancer, our outcomes have been much better with more advanced therapies. So you can have chemotherapy, which sometimes can kill the cancer, but also kill our cells. So that can be a little bit more toxicity associated with chemotherapy. Whereas targeted therapies really target more things that the cancer is using to stay alive and to really continue. And so that means that there are less side effects for us or for the patient that's being treated. But immunotherapy really has become the new wave for cancer treatment, not just liver cancer, but also other cancers. And it's resulting in a lot better outcomes with fewer side effects in the treatment of more advanced liver cancer. So there is hope. There are options, but it's just not thought that these options will be curative. So if you've been diagnosed with liver cancer, don't lose hope. Even if you've been diagnosed with advanced cancer, there are FDA approved treatments like we discussed. It's important to find a doctor that specializes in liver cancer to help you determine the best options for you. And often I see people, unfortunately, only sent to oncologists or cancer doctors or only sent to surgeons, where really the best quarterback for liver cancer is a liver specialist, because they will make sure you're getting the right options and the right treatments at the right times, especially knowing when a curative option is available or helping you get to where a curative option is available, especially making sure that transplant is on the list of options, especially if you have advanced liver disease. So certainly you can see an oncologist and you can see a gastroenterologist, but you really most likely want to be seeing a hepatologist, who is someone like myself who specializes in liver disease. So self-care when diagnosed with liver cancer is important. In addition to working with a liver cancer specialist, here are some actions you can take. Manage your weight, like we talked about, diet, exercise, track your energy, see how you're feeling, work around that when you're feeling tired. Make sure you maintain a healthy diet and drink a lot of water to stay hydrated. And of course, ask for help when you need it. You know, there are resources available to help you on this journey, but you must communicate with your doctor. Again, feel empowered. If something's going on, I hate when I see patients who go to doctor's visits and don't ask for what they need or don't tell the doctor the things that are important to them. Be empowered. You know, it's the visit is for you. It's not about us. It's your time to get your questions answered. It's your time to get the support and resources you need. So make sure you take advantage of that time with your physicians. So let's recap. Know your risk factors. We've talked about a lot of them. Make healthy choices. Take action, like we talked about, to get screened, to get tested, to be empowered over your health, to talk with your doctor, to ask the questions that need to be asked, know your options, keep communicating with your doctor. And we've covered a lot in this session. I want to make sure I have a little time for questions. But if you want to learn more about liver cancer, you can go to loveyourliver.us, loveyourliver.us. And I would be happy to um, finish with this last question, and then we'll get to your questions.
Absolutely. Well, I think for this one, we just know that, everyone's going to make an appointment with their doctor. They're going to get screened and they're going to share this amazing information with their friends. So I'm going to move forward. And just at this point, number one, thank Dr. Landry, whom I'll do again, but also thank our sponsors for this event, AstraZeneca, Merck, and Genentech. Now, I saw so many questions coming in, so many questions coming in. So Dr. Landry, I want you to get ready. Now, we thank you for attending. We do want you to stay for the question and answer session. But as Dr. Landry said, there is a website you can go to, that Love Your Liver US website. You see it there on the screen. But if you're on your computer, you definitely can take out your phone and scan that QR code. So let's just jump into some questions right now, Dr. Landry. And I'm going to keep that up just in case folks want to continue to write down that Love Your Liver website information and scan that QR code. So let's see, where do we start? You spoke a lot about smoking and smoking being a risk factor for liver cancer. Does that include vaping with nicotine or smoking a hookah with nicotine? Does it include all types of smoking?
Yeah, we typically worry about all types of smoking as it relates to the risk of cancers. It has not been studied as much in liver cancer. It's more that we've seen it in lung cancer. And so we think still things that are in the vapes, in the hookah, because there's a lot of mixture of things in there. And there are many people in growing concern that hookah is not really being done the right way, like inside spaces where there's a lot or higher concentration, and that it can have more toxicity. So I do worry about all forms of smoking as it relates to cancers, but as it relates to specifically liver cancer, we really don't have as much information as we know in terms of its risk factors for lung cancers and also just lung damage.
Okay. Now, am I at a higher risk, or is one at a higher risk of developing liver cancer if they are a survivor of another type of cancer?
Yeah, so that is always a concern depending on the treatment you got for the other cancer. So we've learned that treatment for other cancers does increase the risk of a second cancer developing. So, for instance, if you received like radiation therapy, then sometimes that radiation therapy affects other organs because those other organs are in the way of the radiation and can increase the risk of those cancers. And I have seen people either receiving radiation therapy and it affects the liver and then causes liver damage. And like we said, that pathway from liver damage to cirrhosis to liver cancer. So therefore, that's one mechanism by which it increases the risk of liver cancer. And I've certainly seen patients who've been treated for breast cancer or other like lymphoma or leukemias who've had repeated kind of chemotherapy treatments be at risk for liver cancer. But again, it's usually because they have significant liver damage that then results in the risk of liver cancer being increased.
Okay. Now, you also spoke about diabetes and the prevalence of diabetes in the African American community. And you also spoke about obesity and things of that nature. But is there anything that you recommend that someone could do to detox their liver to help prevent liver cancer?
Yeah, that's a good question. I mean, I get this all the time, and I have patients come to me all the time with bottles. It says like liver detoxification. They tell me somebody told them this can help with their liver, that can help with their liver. And honestly, I tell them really don't use any of it. The most common cause for abnormal liver tests, or one of the most common causes for abnormal liver tests and significant liver damage, are supplements and herbal supplements. And so the problem is we just don't know which of those medicines is safe, and none of them have been really well tested or validated to improve liver outcomes. So much so that we usually think of things like milk thistle and turmeric. Those are the kind of supplements that we hear all the time as helping in liver health. And I used to not mind my patients taking those versus these kind of random liver detox where we don't really know what's in the ingredients. But even now, we have growing data that turmeric and even milk thistle are associated with drug induced liver injury. So there's really nothing that I would consider safe to take that can help to really detox your liver. And I certainly recommend that my patients stay away from any supplements because of those risks that I mentioned. The one thing that, interestingly enough, has a signal for helping with liver health is coffee, which is surprising. But you have to drink like 3, 4, 5 cups of coffee. Now, that could have other implications in terms of causing like arrhythmias or making your heart beat fast or other problems or feeling jittery or anxious. But studies again and again have shown that coffee seems to have some protective effect with the liver. But most of the times, I just tell my patients, look, if you're at increased risk of liver disease, just work on those risk factors that you can modify, right? Don't eat a lot of processed food. Cut down on the red meat. Make sure that you're keeping your blood sugar controlled. Make sure that you're eating well, exercising, limiting alcohol. Those are the things that I usually recommend versus taking something else in particular that will allow for what people call liver detoxification, because I don't know that we really understand that there really is something that we can do to achieve that.
Now, you talked about obesity, and we all know we like good food. And thank you so much for giving us some good examples of what we should eat and what we should not eat. But there's so much talk now on social media about these shots that you can get to help you lose weight. Do you recommend any of those shots as a way to help prevent liver cancer? Let's say if you are obese.
Yeah, so I don't recommend the shots necessarily as a way to prevent liver cancer, but I do often recommend the shots as a way to lose weight, especially for my patients, a lot of which I see have non-alcoholic fatty liver disease, as we mentioned. Now, these shots are not approved, they're not FDA approved for non-alcoholic fatty liver disease. So I want to make that clear. But certainly, when you have non-alcoholic fatty liver disease, I really encourage my patients to lose weight because the recommendation is lose about 10% of your body weight. Make sure your blood sugars are controlled, your cholesterol is controlled. Well, these new medications, the GLP-1 agonists, are very effective at weight loss and blood sugar control. So I certainly recommend my patients take those if they have access to them, because I do think they're overall beneficial for their fatty liver disease. And therefore, if you go down the road, then hopefully it'll prevent their risk of developing cirrhosis and liver cancer. But again, these medicines have not necessarily been approved for those indications.
Okay. Now we know we have the website here, loveyourliverus.us, that will give them some information. But where can one find evidence-based guidelines for some of the information that you've shared about liver cancer?
Yes. So there are different resources. So our big liver society, the American Association for the Study of Liver Diseases, has guidelines for all types of liver disease. So that's a place where you could find information about liver cancer specifically. Now, it's tailored more towards providers, but I do have a lot of patients who like reading that type of content and find it very helpful. Certainly, the Centers for Disease Control. You could probably also find some good epidemiological data around hepatitis C, hepatitis B, as well as liver cancer there.
Thank you. One last question, Dr. Landry, and all. I do apologize we weren't able to get through all of your questions, as I said in the beginning. But you mentioned a few times about hope, having hope, that there is hope if you've been diagnosed with liver cancer. What closing thoughts do you have on making sure that the audience has hope, and also hope for the caregivers, because we're not on this journey alone with liver cancer. So what would you recommend to the audience to help them maintain their hope?
Yes, I think you have the hope because with knowledge is power. And today, this is where you're starting, or hopefully, this is the beginning, middle, but it's certainly not the end of your journey with being empowered. And so, I think you have hope knowing that you have the knowledge of what's going on, what the risk factors are, how to diagnose, what the treatment options are available. You won't be specialists by the end of this talk, but you have enough to have those conversations. And I think that's very powerful. So, that should give you hope to go out Ask the question that you need of your doctor to get screened. And not just for you, but more importantly, I hope that you will feel empowered to share this with your friends and family and other people, especially in the African American community, since we're so disproportionately affected by liver diseases that I've mentioned, as well as liver cancer. So I think the hope is in the knowledge and the power that you've gotten here today, but that you can also build upon what we've talked about and then take that into the communities where we live.
Thank you so much, Dr. Landry, for this engaging discussion on liver cancer and the impact it has on the African American community and what we can do. I mean, we've learned about liver cancer risk factors and why we should take special note of these risk factors. We also want to thank each of you for taking time out of your day to learn more about liver cancer. You have empowered yourself with information, as Dr. Landry has said. Share that information with your loved ones. Do prioritize your liver health and go see your doctor for a regular checkup. Ask about those things that Dr. Landry mentioned to you. Talk to your doctor about your risk factors for liver cancer that you believe you may have. And remember, go to loveyourliver.us, and I'm going to spell it now, LOVEYOUR.LIVER.us, where there's a ton of more information available for you. You can take that information, share it also with your network. We want to thank you for your time and we bid you a great good night.